Wellness by Designs, and I'm your host, Andrew Whitfield Cook. Today we're welcoming Hayley Fogarty, who's a naturopath specialising in corneotherapy. Welcome to Wellness by Designs. Hayley, how are you going?
I'm good, Andrew. How are you? Thanks so much for having me.
Absolute pleasure. Now, what exactly is corneotherapy, please?
Yes, so corneotherapy is really a special type of skin modality. Its main principle is correcting and restoring the barrier, which is our outer layer of skin, so the stratum corneum, and really supporting the first and third line defenses of the skin. So that's the acid mantle, the microbiome, the multilaminar lipid structure, and making sure that we're kind of respecting the skin and all of its systems at all times.
Okay, so you said first and third lines of defense.
Yes.
Second line is?
Well, I guess first 2/3 lines of defense.
Oh,
so the
forgive me.
acid
Sorry.
microbiome and the multilaminar lipid structure. So there are 3 lines of defense.
Okay, and can you tell me a little bit about your history and why you decided to specialise in looking after skin conditions and everything within?
Yeah, so I started my naturopathic degree in Perth. So I did 2 years of that. And funnily enough, during that time, I actually was experiencing quite a lot of my own skin issues. So eczema is something that I've always kind of struggled with as a young child. And then it kind of developed into more of dermatitis presentations as I got older. So then when I moved to Melbourne, I started working at a clinic while I was still studying my naturopathic degree, and they were using corneotherapy there. And I kind of just, the philosophy and the way corneotherapy treats skin just made so much sense to me. So I was very fortunate enough to be trained and mentored there, and we saw lots of different skin conditions. So it was really like a boot camp for training for skin. And yeah, since then, I've just been on that path, and I love combining my naturopathic knowledge also with corneotherapies, because both of the modalities are really aligned in really finding out what the root cause of the skin issue is and correcting deficiencies within the skin and bringing the skin back into homeostasis, just like we do in naturopathy.
Tell us a little bit first, though, about like the stratum corneum and the different layers of the skin, because I mean, my nursing knowledge taught me that the stratum corneum was dead. That was it. You couldn't get anything through it. It was an impervious barrier, even relatively waterproof unless you're soaked for ages. Seems like this isn't the case.
Yeah, so I guess a lot of the beauty world refers to that final layer of skin as dead skin cells. And it's really incorrect terminology, because they're not dead until they actually fall off your face and they're on the floor. So the final layer, our stratum corneum, is still alive. I kind of like to use the analogy of imagining it like a smart roof. So you have your roof tiles, which are your corneocytes, and they're held together by glue, which is your ceramides. And their role is really to tell the rest of the house what's happening in the external environment. So that top layer has communication pathways down to the deeper layers. So it's always sending signals like when it's hot, when it's cold, if there's changes in humidity, if there's UV exposure. So the underlying skin cells can kind of adjust accordingly. So it's really there to protect us from that outside world and send those beautiful messages down into the deeper layers. And yeah, of course, it's definitely waterproof. A strong, healthy barrier will be nice and waterproof. And if we've got no tiles missing on our skin roof, then we're going to be keeping all the good things in, like water and oil, which are really protective, but we're also going to be keeping those external factors out of the skin as well. So our philosophy with corneotherapy is always to go back and repair your skin roof. And that just means that everything in the house will function more optimally.
Okay, so just talking about that sloughing off of the skin, we think about beauty therapies, dermabrasion and even just scrubs and things like that. If you're thinking about corneotherapy, about putting stuff on the skin, how does that allow for the normal sloughing off of dead skin cells? Perhaps I'm oversimplifying it. Like, are you stopping normal sloughing of skin by doing anything?
No, definitely not. So I guess if you're going in and repairing that barrier and you're feeding the skin all those beautiful nutrients, then it's going to be functioning more optimally, which means that skin cell turnover is going to improve. So it definitely helps with that natural desquamation of that sloughing off kind of function of the skin. So it's not about putting anything on the skin and inhibiting that. It's really about allowing the skin to do what it naturally should do in a healthy way, if that makes sense.
Yeah, no, absolutely. I've got to ask, though, about absorption, and I have discussed this with a couple of people, Amy Skilton and Mary Louise Condon, but to get your take on this, because this is something where I'm only just waking up, and that is absorption. We talk about being a waterproof protective layer, if you like. And I was taught that it was impervious and that there was no absorption of nutrients through it. But that doesn't seem to be the case, right?
Yeah, so absorption is definitely one of the roles of the skin for sure. Keeping things that shouldn't be in the skin is definitely a part of what the skin barrier function is doing. Also differentiating between absorption and penetration. So absorption is when like certain chemicals get through the stratum corneum and actually get into the bloodstream, whereas penetration is when a chemical gets down into the deeper layers and stays within the skin. So probably the better terminology would be penetration of certain ingredients into the skin. So that's what we're preferring because
Yep.
Even though a lot of skincare can get absorbed into the bloodstream, and we've got to be cautious of what we're putting on the skin because we know we don't want to be putting anything harmful on the skin that could get absorbed into the bloodstream. But there's definitely ways of products penetrating through that top layer. It just depends on the way those products work. If you have to use kind of harsh or abrasive chemicals like AHAs and BHAs to disturb that barrier to get those ingredients down, then you can run into some issues. But if you're using skincare that contains a certain technology that allows that penetration of actives to get into the skin without damaging that stratum corneum, that's kind of what you're really looking for.
AHAs and BHAs, alpha hydroxy citric acid, is that what it is? Alpha hydroxy acid?
Yeah, alpha hydroxy acids, and then you've got beta hydroxy acids. And
when are
they all.
Sorry, when are they used? What's their differences?
So it really depends on the concentration. So AHAs are typically more of a stronger form of chemical exfoliation, whereas BHAs are a little bit more of a gentle form of exfoliation. So it kind of depends on what you're going for. The skincare range that I use, we don't use AHAs because we believe that is too disturbing to the barrier.
The snake skin.
Yeah.
So tell us a little bit more about the beta hydroxy acids. Chase.
Yeah, so your beta hydroxy acids, we use a beta hydroxy acid in the Dermaviduals range called salicylic acid. So we actually have salicylic acid in our skin cells already, and that helps with that natural desquamation process without going in too aggressively and again, removing that stratum corneum, because some AHAs and chemical peels not only remove the first layer, but can remove up to the first top 3 layers of the skin. And I like to explain it to my clients, we really want those skin cells to come to the surface and mature before they desquamate. If we remove those top 3 layers of skin cells, then we're really exposing teenage skin cells. And I like to use the analogy, it's like letting teenagers off in the house. You know, they haven't quite matured enough to be in the outside world. And then there's issues with communication within those skin cells as well. So let alone removing really important lipids from that top layer too. So we can lose a lot of water through the skin if we don't have those top couple of layers protecting us.
I'm loving your analogies, like letting teenagers loose in the house.
Yeah.
You're talking just about... Well, it gels with something somebody I spoke to the other day about keeping things simple. And it was really amazing how we can, particularly in something like skin, you know, where you can throw away these really technical terms, and they just confuse the patients. So they don't go away with knowledge, they go away with overwhelm. Anyway, you were mentioning communication there, and talking about the maturation of the different layers. Can we go through that a little bit and how that's affected by various conditions? I'll go into how you're treating the conditions a little bit later if we could. But with this communication, what's happening there?
So, yeah, I guess as I explained, if you are removing that barrier, then the communications within the deeper layers can get a little bit confusing. So those deeper skin cells aren't getting that information about what's happening in the external world. Say, for example, you know, you're coming out of autumn into winter, and all of a sudden that humidity in the air drops and you go into more of a lower humidity type client. People normally notice those couple of days their skin is feeling really, really dry. And then all of a sudden those deeper layers get those messages and they go, all right, we need to send more essential fatty acids to the surface of the skin to really line that barrier. So that's just kind of one example of why that cell-to-cell communication is important. Also, if your barrier is disturbed, what sits right underneath your barrier is your immune system. So all of a sudden, your immune system, if you imagine there's no tiles on your skin roof, your immune system is all like reacting to every little thing that's landing on the surface of the skin. So that's another way that communication can break down as well. And then you're seeing inflammation, you're seeing redness, you're seeing tight, dry, potentially skin that is breaking out in perioral dermatitis. And the same kind of applies for acne. So that communication within the skin has been disturbed. So all of a sudden you have that C. acne bacteria over multiplying. Maybe your oil production is getting, is too high or not high enough. So there's kind of lots of different things that are happening within the skin when you damage that cellular communication response.
Yeah. Now, you were mentioning something there that really feeds into the skin microbiome as well. So how do you employ, I guess, probiotics? Do you employ them both internally and topically, or do you employ different ones for the skin?
Yeah, so we definitely we've got bacteria, we've got yeast, we've got mites on our skin. And I say to clients, these are all good, things that should be on the skin. It's really when the environment of the skin changes that we can see an overgrowth in certain bacteria, like C. acne bacteria. It used to get called P. acne bacteria, but now it's been changed to C. acne bacteria. Staphylococcus aureus, which can obviously lead to staph infection. That microbiome is really, really important.
And sorry, we were also discussing before fats and oils and things like that. So can you take us through the penetration of the fats and oils? Do you choose things like, macadamia oils, for instance, that might have a high monounsaturated, or do you choose different variations or types of fats depending on the condition that you're treating?
Yeah, so essential fatty acids are so important for skin cell health. So they line our skin cell membrane. So definitely kind of the range that I use, there's lots of different essential fatty acids. Yes, we definitely have macadamia oil. We use kiwi seed oil. I always laugh at kiwi seed oil because I can just imagine and then like pressing the little tiny baby kiwi seeds and making oil out of it. We use
kiwi seed.
Kiwi seed oil. Yeah, it's amazing. It's full of essential fatty acids and omegas. I just wanted to go back to that point of probiotics in the skin, actually. So I have probably in the last year have definitely been experimenting with giving clients actually breaking open a probiotic capsule. And it works really nicely for my eczema dermatitis clients. So yes, definitely internally, but I have a protocol that uses actual external probiotics as well. And I find that works really nice at repairing that microbiome. Yep. But yeah, back to essential fatty acids, super, super important for the skin. We also use Boswellia resin, which is really anti-inflammatory and full of essential fatty acids. And then you've also got the essential fatty acids that this that's naturally found in the skin. So the range that I work with mimics those essential fatty acids in the skin and uses plant-based ingredients, which is quite cool as well.
Just on that point of Boswellia that you made, like, is that hard to procure as a raw material?
So, I mean, I'm not part of the kind of manufacturing process. So the range that I use is formulated in Germany. So yeah, it'd be really interesting to know how they procure the Boswellia resin. But I mean, that would probably be something you'd have to ask them. But in terms of like my practical application of Boswellia, we use it in lots of different skin conditions. So I use it in my acne clients, I use it in my eczema clients, I use it in my rosacea clients, just because it has such powerful anti-inflammatory properties. Really helps to reduce collagenase, so it helps with that, slowing that breakdown of collagen elastin in the skin. So it's really good for, using in healthy aging. Yeah, it's a pretty amazing all-rounder active that we have, which is quite cool.
I've got to say, like, the use of that, it makes sense, but we've never thought of it, never taught it, never learned about it, sort of thing. I guess no commercial company in Australia has released it, so of course there's no need, but it really does make sense to use. Well, we're sort of more attuned to using things like myrrh, but Boswellia, it's related. So certainly these sort of resinous components. I also had another point to ask you about the probiotics that you were using. Do you tend to stick to one species or strain, or do you tend to use a mix, or do you tend to employ a base like yogurt to apply them? How do you utilize them?
Yeah, so I haven't tried yogurt on the skin, not yet. I like to use a spore-based probiotic. So it has, a few different strains in it. I find that works really nicely to help, bring that microbiome on the skin back into balance. Because especially when I'm looking at an eczema or a dermatitis, inflamed skin, then typically that microbiome has been disturbed. And when the microbiome's been disturbed, that can just be setting off a cascade of inflammation. So it's something that I've definitely been experimenting with clients and getting good results with that. But I haven't gotten down to the point where I'm using exactly different particular strains on different conditions. I've just found that particular probiotic works really nicely. And in all the research I've done, that's kind of something that is being typically applied to skin conditions as well.
Right. That's really interesting. Like, it's really interesting how we judge probiotics, or I should say bacteria. We'd like to own them. They're all human. They're human strains. But it does make sense about these. Now, are you talking about coagulants? Bacillus coagulans? Is that what you're referring to?
Coagulants. It's kind of 5 different bacillus. So there's Licheniformis in there. There's Indicus, Subtilis, I think.
Bacillus, yeah.
So they're kind of supporting the immune function in the gut, but then we know our gut immunity and our skin immunity is really intrinsically linked. So it seems to be working for my clients. Yeah, definitely be something that I'd love to kind of do a bit more research into, and how it's actually having that really deeper kind of influence on the skin microbiome. But it's definitely new kind of exciting research that's coming out as well. So yeah, I'll stay tuned for that.
But it really sparks my interest, because although we know we're smothered with the maternal microbiota upon birth, hopefully, and that they can set up populations, resident populations, we also interact with the outside world for the rest of our lives. So we're picking up dirt and handling dirt, and so it would make sense that we look to some of those organisms to be natural or co-inhabitants of our skin, and possibly having therapeutic activity. It's really interesting.
Yeah, and it kind of also be quite interesting to seeing like what those different kind of bacteria and how they're communicating with the outside world as well. I think that would be interesting to kind of look too.
Yeah. So let's go into some of the conditions. You've mentioned like dermatoses and things like that, but can you detail what you use in certain conditions, what you've found of benefit?
Yeah, so I guess the main ones that I treat are, as I said, acne, eczema, dermatitis, treat a lot of rosacea, have treated some autoimmune skin conditions as well, and some fungal skin conditions too. And then I get people coming in just wanting general skin health, so things that are going to help with pigmentation, things that are going to help with aging, and then just general dull, lackluster skin. So I always say my first point of call with my clients is let's get those foundational ingredients into the skin first. And when I'm talking about foundational ingredients, how we really look at skin is it's like, okay, our skin's an organ. It has lots of different nutrient requirements. What are those different nutrient requirements, and how can we refeed the skin those beautiful nutrients? So I think in the beauty world, we're so far removed from the fact that the skin is an organ and has lots of different functions and nutrient requirements. And it's really going back in there and refeeding the skin. First of all, things like phosphatidylcholine, triglycerides, fatty acids, cholesterol and things like that, and also our ceramides. And then once I've kind of done that, probably after 6 to 8 weeks, then I can start introducing different serum actives into their program. So another analogy for that is like, let's go repair your roof and the structure of your house and the floors and the walls. And then in 6 to 8 weeks time, we can introduce the furniture and the cool artwork. And that's those serum actives that really have that kind of punchy response in the skin. When I'm treating acne in terms of serum actives, and the actives that I have to choose from in the range that I work with, we have 40 different actives. So we have vitamins, we have minerals, we have herbs, we even have an algae as well. So in terms of something like acne, I might be looking for an active that's really high in linoleic acid, because that's actually a fatty acid that acne clients are really deficient in. Phosphatidylcholine is another ingredient that I love to use in acne. I use a bit of azaleic acid, and that's really anti-inflammatory and has antimicrobial, microbial regulating properties to it. I love B vitamins as well. So B3, B5, B6, B7, they're great for that post-inflammatory pigmentation you get left behind with acne, help to regulate sebum production. I love using zinc as well. So zinc's very wound healing, and also green tea. And all of those different actives also help to reduce 5A reductase in the skin, which we know if we're reducing that conversion of testosterone in the skin, too much testosterone in the skin is going to upregulate oil production and also make our oil quality thick and gluggy, so getting trapped in the follicle. And then once that follicle is a little bit inflamed, then those P. acne bacteria start to feed on that oil production and have a little bit of a party. And then I also love at some stage introducing like a vitamin A in the skin for acne. In terms of dermatitis, and I see a lot of like perioral dermatitis, which kind of presents from the nose, around the outside of the mouth and on the chin, and also periorbital, which can kind of present around the eye area as well. Again, I love using phosphatidylcholine. I love using boswellia for dermatitis, for those anti-inflammatory essential fatty acid properties. Sometimes I use kiwi seed oil as well for those nice essential fatty acids. And then kind of once I've got that under control, I'm looking at an active called EGCG that really helps to strengthen the filaggrin formation, which a lot of dermatitis clients suffer from, is something called a filaggrin gene deficiency, which means they're just not great at making a good skin barrier. In terms of rosacea, again, I'm using boswellia, I'm using phosphatidylcholine, I'm using something called tranexamic acid, and sometimes I introduce echinacea as well, because we know echinacea is a really nice immune regulating property.
Take me through, forgive me, was it azaleic acid?
Yeah.
I don't know that at all. Where do we get that from?
So it's azaleic acid or azaleic acid, depending on what you want to call it. It actually comes from a yeast.
Right.
So it's produced by a yeast. So we actually produce azaleic acid ourselves. So it comes from the Malassezia yeast. In terms of how they actually formulate that in a active, I'm assuming they create that from a byproduct of some type of yeast. So it's getting definitely more common in the like beauty world. It's really, really anti-inflammatory. It again helps to regulate the microbiome in the skin. So that's why, for example, something like it's really great for rosacea, because we know with rosacea they have about 18 times more demedx mites in their skin. So, and those mites can be causing inflammation, which is quite interesting as well. Sometimes we look at rosacea and we think redness and capillaries, but we're also got to think of the microbiome on the skin as well. And again, it's a 5A reductase inhibitor, so it's great for acne. It's a bit of an all-rounder. It's a bit like boswellia. It can do a lot of different things.
Yeah. So that's really, like, I'm just thinking here about, there's about 10 different questions whizzing around my head. Like, one is when you talk about, did you say 5 to 10 times as many mites?
18.
18 times. Okay. So question there is that cause or effect? Are they there because they're trying to do a job cleaning up stuff, or are they the cause of it and what's led to them overgrowing? Does anybody know? Like, do we...
Well, I guess again, if your barrier is impaired, then it can be changing that microbiome. But in terms of the demedx mites, that's an interesting one. I mean, we know with rosacea that usually when I'm looking at rosacea clients, I'm thinking what's going on with their gut. So is there a link between, kind of dysbiosis in the gut, which is causing dysbiosis in the skin? So that's kind of an interesting one. And
you were saying that fatty acid was made from a yeast. Is that sorry, it's gone blank now. Malassezia?
I think you might be thinking of tinea versicolor, where you get the hyperpigmentation on the shoulders. So we have Malassezia yeast all over our body. But it's mainly predominant in our scalp because we have so many sebaceous glands. So the yeast loves feeding off our sebum. So that's why some people might experience, because that yeast actually starts to come down the back of the neck, and then it can kind of be populating more abundantly in the shoulders, and then it actually starts to inhibit pigmentation in the skin as well. So I think that's might be where you're going.
Yeah, gotcha. And of course, you were getting to a place where you were talking about not just the roof capping and then the furniture and the artwork, but now we have to address the sewage system. So we have to treat internally as well as externally. So how do you balance both the internal and external? Because you specialize in corneotherapy, but obviously as a naturopath, you'll be treating internally as well.
Yeah, so I definitely believe we kind of need both. We need to be doing all the right things externally, using really, really good quality skincare, making sure we're not doing anything to harm it. But then, of course, internals play such a huge role in skin conditions. So anyone walks in with a skin condition, I'm thinking, all right, what's going on with your gut? What's going on with your hormones? What's going on with your lymphatic system, liver? What's going on with your nutrition? How's your diet? What's happening with your stress? Lifestyle factors, drinking too much alcohol or smoking, and all those things are going to play such a pivotal role in our skin health. And you'll notice that. You'll see people with really beautiful, healthy skin, and 9 times out of 10, they've got a good diet. Their stress is down, and, normally their gut and their hormones are functioning correctly. So I'm a naturopath, but then I also have a naturopath who works for me called Melissa. So she's really focusing on my big internal cases, which is amazing. So that kind of naturopathic understanding really helps me to guide the client into what type of care they might need. Do they need further, GP testing and functional pathology testing, while we're also doing the externals as well. So it's really that holistic picture, and looking at skin health.
Do you get any clues, concentrating on acne at the moment, do you get any clues as to the presentation of acne, whether it's high on the cheekbones or low on the jaw or anything like that, as to what the hormonal imbalance could be? I remember some people teaching this, and it didn't sit with me from a physiological point of view, but yet I've spoken to people that have got really good results. And I'm like, okay, where do we sit with this?
Yeah, I think it kind of originated, it's like kind of TCM, that facial mapping. I think that's where it originated from. And yeah, definitely. I mean, I've seen thousands of skins, so I can kind of pick up pretty quickly when someone comes in and presenting with acne, why they might be presenting with acne. I typically find the forehead can be more of a gut diet presentation. I find in between the eyebrows and the temples can be liver congestion. Upper cheeks, I find small intestinal bacterial overgrowth is quite common. And then, that typical jawline presentation, I'm thinking, okay, what's going on with your hormones? And then really anything close to the mouth, I'm thinking gut as well. So they're pretty common patterns that I see with my acne clients for sure. And it's just the more faces you see, the more patterns you start to link. It doesn't mean that you kind of just, naturopathically prescribe them based on what's going on like visually, but it does give me clues as to where it might be stemming from, and also different ages as well. So if they're coming in as a teenager, I'm thinking, all right, that big dose of hormones is hitting in. Are they on dairy? I can always see if someone's intolerant to dairy. Right. I can tell that pretty quickly. And 9 times out of 10, I'll say, do you have a lot of dairy? And they're like, yeah, I drink like a glass of dairy a day. And I'm like, yeah, I can see it in your skin. So there's definitely clues that kind of do that.
What's the presentation?
Yeah. So typically a lot of inflammation around the nose, kind of congestion around the nose. I see that a lot with dairy. Sometimes it can be breakouts on the forehead as well, but that around the nose presentation, I'm thinking, yeah, that person's having a bit too much dairy for sure.
That's really interesting. And what about other therapies that you employ? Like things like, we're all well aware of the alpha and beta hydroxy citric acids. Hydroxy citric acids or hydroxy acids?
No, yeah, hydroxy acids.
Hydroxy acid. So we're quite well aware of those, but what about physical things? What about, acupressure, acupuncture, needling, things like that?
So yeah, in my clinic we do facials, and I love doing we do a lymphatic facial massage, which is also really important to get the lymph moving and to get circulation to the skin. And then I also offer something called skin needling. So this is a type of treatment that we use tiny stainless steel micro needles, and we penetrate the skin in a vertical fashion. And what that is doing is setting off a cascade of response underneath the skin to start eliciting a scarless wound healing response. So great for stimulating collagen, elastin production, hyaluronic acid production. So really good for fine lines and wrinkles. Great at reducing the appearance of acne scarring as well, because I get in there with the needle and I break down that old scar tissue and then lay down that new collagen elastin. And I definitely do incorporate some gentle facial acupressure. I would love to do some more training in that. I think that would be amazing. And then also in my clinic, I have 2 other therapists, and one is an energy medicine practitioner and one is a kinesiologist. Because definitely in my years of experience treating skin, it's not just physical, so the externals and the internals, which we treat with corneotherapy and naturopathy. There can also be emotional blockages within the body that's preventing healing on a physical level. So I really think it's important to kind of tap into that subconscious energetic element that everybody has. So that works really nicely for some of my clients as well, that mind-body kind of spirit connection.
That really tags into another podcast I did on wellness by designs, and that was with Natasha Sidotti about listening to your patient and what their language was telling you, not just the symptoms that they're presenting. It was really interesting stuff. So everybody, have a listen to that one if that interests you. Can I just ask you about the when you're talking about the acne scarring, was that to do with is it called box scarring? Is that right? Is that the correct term? Where they're quite deep and the needles can break it up. Is that right?
Yeah, there's a few different presentations. So people that have typically had cystic acne, what's happening is not only is it disturbing the epidermis, but it's actually disturbing the dermis. So the inflammation goes down into the dermis, which is our kind of second layer of skin underneath the epidermal layers. And in the dermis, there's collagen elastin. So that inflammation has actually caused trauma to that collagen elastin, which means all of a sudden that collagen elastin is lost. So yeah, you get that box or ice pick scarring that some people have as well.
Got it. And obviously we've got to talk about safety things. So what about, when you've got rampant infections, you've got school sores or herpes rather than, just a rash or a rosacea type presentation. You've got to be really on your game to pick which is which, right?
Yeah, for sure. And one of the things we do, we send out a kind of client questionnaire before we see the client, and there's all those questions in there. Do you have an active cold sore? Do you have an active staph infection? So we can pick it up before the clients even come in, and ideally reach out to them and just say, make sure you go away and get this cleared. Or if they present into the clinic and they do have that, we just say to them, we can't do any treatments today. Please go away and refer them to the GP to get a swab or, whatever they need to do to kind of help reduce that cold sore infection. So yeah, that's kind of the top priorities, definitely making sure we're aware of what staph infections look like, different type of infections look like, and that, cold sore, kind of viral infections look like as well on the skin. So yeah, that's definitely the utmost important. In terms of the therapist that I have, I mean, one's a naturopath and one's also a nutritionist. So we've all been through that kind of level of, we've all been through that education in being able to spot red flags as well. So I feel like this really helps us kind of, gives us that extra bit of knowledge, to understand, okay, this person's presenting with this. Is this in our scope of practice, or is this out of our scope of practice? And when do I need to refer to a GP? When do I need to refer to, a psychologist or whatever it may be, or when I need to send them straight to hospital?
Right, okay. Hopefully not. Just a last question as well. How open are you to working alongside pharmaceutical therapy? You've got fulminant conditions sometimes. People go through horrid presentations of psoriasis and, weeping dermatitis. How open are you to working alongside that sort of therapy, and what's your goal? Is it to eventually wean them off or reduce their need for the pharmaceuticals?
Yeah, and I mean, this is definitely something from personal experience. I've had to, in terms of skin stuff that I've had in the past, I've had to, at times use topical steroids because my skin condition was so severe. So I feel like that was a really great learning lesson for me to go, there's definitely a time and a place for those pharmaceuticals. And yes, we can 100% work alongside whatever medication topically or internally that they're on, and just having a very measured approach to that as well, but also offering our clients education on those pharmaceuticals. That's a big part of what I do too, on the pros and cons to all of that. So giving the client, really empowering the client as to what direction they want to head. And if that's something that they want to eventually wean off, I do see clients going through topical steroid addiction, topical steroid withdrawal. That's kind of a niche of what we treat as well. And that's really not cutting anyone off cold turkey from a topical kind of application that they might have been using their whole life. It's really working with that client to help repair the barrier, also to help, support them internally, and then really weaning them off slowly. I found that's always been the best method. So working with the client where they're at and making sure safety is always paramount.
That's really interesting. Can I ask you, from your experience, do you find that those people that sometimes have to rely on pharmaceuticals, let's cherry pick and go the topical steroid cream, 1%, whatever. Do you find that stress is the hallmark of when they need to start using it, or do you find that seasonality has a big play, like when, as you mentioned, when winter comes into effect and there's that drop in humidity? What's the major factors playing on that?
Yeah, I mean, I guess like doing a long kind of history, like, is that client, atopy presentation? Have they had eczema as a child? What's going on with their barrier? Does their skin naturally produce enough lipids? Are they a lipid dry skin presentation, which means they're going to be more susceptible to things like eczema and dermatitis? That's kind of important to establish initially. And yeah, of course, winter hits, and people that are prone to eczema and dermatitis, that's kind of the worst time for them, because that humidity in the air is being reduced, so it's not protecting the skin anymore, and they're losing lots of water through their skin. And of course, stress can be a big influence, and diet. Things like gluten can be quite inflammatory for those type of skin conditions. Obviously, again, sugar and dairy can also be quite inflammatory. So there's so many factors that are kind of influencing why someone might be using those topical steroids, for sure.
I said one last question, but there's one last question. Evening primrose oil. Evening primrose, we're talking 25 more years ago, was, a herald. It was the essential fatty acid that we needed. And there was work by Professor David Horobin, which supported its use. Of course, he was lambasted after he died, because basically all of the positive research for atopic dermatitis using of course, it was his evening primrose oil, was by foundations supported by him, and none of the independent studies supported the results at all. Having said that, I know people that gain great benefit out of evening primrose oil, not fish oil, which we sort of jumped to. Are we jumping back, or are we tending to use a balance of essential fatty acids now?
Are you talking obviously internal application, so taking evening primrose oil internally?
Yeah, forgive me, yes.
Yeah. I mean, I guess, we're looking at evening primrose oil being an omega-6 fatty acid. So I guess the beauty of essential omegas, you're getting that omega-3. I mean, I think both can be beneficial for sure. In terms of what I believe to be the most effective essential fatty acids for the skin, I'm definitely thinking fish oils.
Right.
So yeah, they're just very, very anti-inflammatory. And we know those skin cells aligned with those beautiful lipids. So that's what we're kind of really looking at, is supporting the skin. But in terms of, do I kind of prescribe much internal evening primrose oil? Not necessarily. I'm normally thinking fish oil omegas. Yeah, I'd have to do a bit more kind of research into evening primrose oil, but it's nice to have that mix of omega-3 and omega-6 in there as well.
I think there's been an evolution to the balance. It's really interesting, but also the foundational stuff. Like you mentioned them, delta-6, delta-5 desaturase, and they're not easily, but they're the commonality there. If you look at the enzyme system, is zinc, B6, and magnesium, 3 of the simplest nutrients. Which, do you tend to employ those a lot?
Yeah, for sure. And I'm thinking, issues with, D6 saturation. I'm thinking acne. I'm thinking eczema and dermatitis for sure. So B6, magnesium, yeah, that would definitely be helping. Yeah, that's it. I mean, anyone that comes in with a skin condition, I immediately think magnesium, because it has such a profound impact on a whole system. And I think just in our modern society, I think we're leaching a lot of magnesium and, our kind of busy lifestyles and our stress. So I think skin conditions play a lot into that nervous system stress response. And if you can get people sleeping properly, if you can help them move their bowels properly, in terms of what magnesium is also doing for the skin, is increasing fatty acid production in the skin. So that's also an added bonus as well, and really bringing down that cortisol response. And we know cortisol, again, can upregulate testosterone in the skin, which can upregulate that unhealthy oil production in the skin that can lead to acne. So I think all skin conditions need magnesium. Yeah.
I'm loving your thought processes. Yeah. But it's awesome to talk to you, Hayley. I have to ask, do you have a course, or do you mentor other naturopaths in corneotherapy?
It's funny you ask this, because I had someone call me yesterday, book in for a consult, and she was a new corneotherapist that had just started, and we just had chatted for an hour, and I kind of got off the phone and I was like, that was so fun. So I would love to do that for sure. I mean, there's a few avenues you have to kind of go through as a naturopath before you become a corneotherapist. So there's kind of extra studies that you have to do. But I kind of foresee maybe one day in the future helping with that really practical application of treating skin from an external point of view, for sure. Because yeah, I love the big cases. I love treating lots of different skin conditions. And I've seen lots of different skins as well. So yeah, something in the future, something in the pipeline.
there's so many other naturopaths also that they have a bent, if you like, for treating skin, and they have a love for it. And obviously this love for, you've actually started by need, but you have a real dedication to helping other patients with their skin conditions, and it shines through. So I've got to say thank you so much for giving me a few things to think about. Kiwi seed oil is one of them. But thanks so much for taking us through the finer points of corneotherapy today on Wellness by Design, Hayley.
No worries. I loved it. Thank you so much.
And of course, thank you for your company today. You can find all the show notes and the details of this and other podcasts on designsforhealth.com.au. I'm Andrew Whitfield Cook. This is Wellness by Designs.